When we look at healthcare specifically, research we've done sees the potential to automate or augment over 40% of healthcare jobs, both clinical and non-clinical, through automation and augmentation. Underlying all that, though, is then responsible AI and use. How do you ensure that you are fostering trust with all the stakeholders you serve by putting that responsible foundation in place? And I'd state the key thing for leaders to unlock all those pieces is really to start using AI in everything they do and encouraging workers to use it and exploring how to use AI to reinvent their organization.
Welcome to Building with AI, the show where we engage in conversations with world-class AI product builders and leaders. We help uncover tactical insights to help you build and scale better AI products. I'm your host, Haroon Choudery, and today we're joined by Brian Collis, who leads Accenture's health strategy practice. During the episode, Brian shares his deep expertise in healthcare AI transformation, discussing how health organizations are leveraging AI to reinvent care delivery, overcome workforce challenges, and drive operational efficiency. Brian also provides practical insights on implementing AI responsibly while navigating the complex healthcare landscape, and much more. But before we dig in, here's a quick word from our sponsor.
Autoblocks is the leading AI evaluation platform for product teams. It enables your team to collaboratively iterate on prompts, model parameters, and RAG parameters, while letting you retain full control over whatever frameworks or tech stack you want to build with. Seamlessly run tests to evaluate the impact of product changes on quality. Learn how to ship more reliable LLM products at autoblocks.ai. Now, back to the episode.
Brian, welcome to the show.
Haroon, thanks for having me. Excited to be here.
Yeah, it's super excited to have you on the show. I've heard great things from a lot of folks that we've chatted with on the digital health side who have been engaged with Accenture in one way or another. And so to kick off, could you provide a quick introduction of yourself and your background and your experiences at Accenture so far?
Yeah. So within Accenture, I currently lead our health strategy practice. So for us, that includes working with health plans and health systems and everybody else getting into healthcare. My particular area of focus within that is growth and innovation, new ways to finance care, new ways to deliver care, and new products and services. If I go to kind of our current moment, a big area of focus has been how might we help healthcare enterprises with reinvention enabled by AI, especially as generative AI came on the scene. That's really captured the attention and mind share of both boards of directors and C-suites like nothing I've ever seen before.
Yeah, I appreciate the overview. And as we were talking about before the episode kicked off, you've been at Accenture for over 2 decades now, which is incredible. And congratulations to you. And just curious, over the couple of decades, how have you seen or defined the different eras, not only digital health and healthcare delivery in general, but also artificial intelligence and the role that automation and technology has played in that space?
Yeah, I'll go back to my background, and really my whole career, given that focus on growth and innovation, has been following all the different waves of AI's evolution. And it's been part of what I've done upon joining Accenture over 20 years ago, as you mentioned. And maybe if I go back to the beginning and go, what did I study? This does come back to what did I study as an undergrad? As an undergrad, I double majored in computer science and business. And at the time, this was the Web 1.0 era. And I was interested in how might we solve problems across organizations and society using modern digital technology plus human ingenuity and putting those together to solve problems and make it different. Now, if you go back to AI at the time was more in the background, and I'd say increasingly over the past 20 years has moved towards the foreground. Now, when I joined Accenture at that time, after undergrad, I entered into our health and life sciences practice and started working with both health plans and health systems. And that's really where maybe that first wave of AI started to come into the picture. That was at the era in the early 2000s. We're now in the machine learning era. They're really getting into both diagnostic and predictive uses of artificial intelligence. On the diagnostic side, looking at why did this happen? And on the predictive side, looking at what might happen in the future. And some of my early work in that area was working with large national health plans on rolling out new health management platforms and systems. And at the time, that was using identification and stratification algorithms to really identify who should reach out to help with specific healthcare conditions to help improve outcomes, whether that would be diabetes or cardiovascular conditions, and so forth. So there were these large predictive algorithms trying to determine who should we reach out to and how should we engage. And that's where it started. As we move to like the 2010s, now we start to have deep learning start to move on into become more common as things have evolved. And that was where, as deep learning started to evolve, now we started having AI move from more the background, increasingly to the foreground. And we started to work more in working with healthcare systems on further in prediction, but also looking at vision, voice, and other ways of using deep learning techniques in the healthcare sector. Fast forward to the present, now you have generative AI come onto the scene in November of 2022 with the launch of ChatGPT, really getting AI into the hands of people, democratizing access, people being able to speak with AI, talk with AI, and so forth. And at that point, that really started to shift things where people saw the potential of how this could really have a big impact on organizations and both help with efficiency and growth. And ever since then, I'd say now you have AI in the foreground, really trying to drive organizational change.
In terms of just magnitude of each of these waves of innovation that you've seen over the last couple of decades from, as you mentioned, just traditional machine learning in the early 2000s, then deep learning, and now generative AI, how would you describe the magnitude and the impact of these different waves and how they relate to one another?
Yeah, I would state the magnitude of what we're seeing right now is bigger than I've ever seen. And I'll even go beyond AI and just go to just digital change. If you go Web 1.0, there was interest. You would basically put a website onto a health plan member portal or a provider portal. You would put these websites out there. Mobile comes onto the field as well, mobile social. Your Web 2 era comes in. You're experimenting, exploring. Eventually you'll roll out a mobile app. You knew it'd be important, but it wasn't urgent. It wasn't something that needed to happen immediately. In our current environment, I would say specifically with the launch of generative AI, that's captured the biggest attention I've ever seen. I can even go back, if I go to AI, I was having discussions in the deep learning era, in the 2016, 2017 window, where many healthcare leaders and executives were interested. I would come in and describe, what is artificial intelligence? Why is this important? How could this have impact? And they were interesting, but it wasn't important. It was like, okay. And you started to see people experimenting with different use cases here and there, but it wasn't front and center in terms of solving business problems. Right now, this has captured the hearts and minds of both boards and C-suite leadership teams. And what that's done is it's elevated it from decentralized use cases or algorithms being used across functions all the way up to a leadership conversation to go, how might we reinvent the healthcare enterprise? How do we use this to solve some of the challenges we've been facing, whether it's work shortages, SG&A challenges, medical costs, and so forth, and seeing this as the potential to be able to do so. The current moment, I think because people can experiment with it and see hands-on, you're starting to see real understanding that this can create new ways to create value as well as new ways to deliver value. Now, there are still many challenges with that. How to actually unlock that value becomes a big challenge, but you at least have catalyzed that interest in seeing the potential.
Would you say that the biggest difference is that it's just a lot more familiar to folks because ChatGPT, the fastest growing consumer application of all time, was something that was palpable to a lot of these folks all the way up and down organizational hierarchies at the biggest companies in the world to the smallest companies in the world. And they were all able to have that aha moment themselves. Would you say that was the biggest catalyst to getting these conversations to become very present and important in these board level conversations, or was there more to it?
The fact that people could chat with artificial intelligence and interact with the algorithms and get value using natural language was really one of the big forces. And I would say because of that, people saw that you could now use these algorithms to create. You could use them to adapt models. I can upload a news article or a journal article, and I could summarize it. I could ask questions with it. People were able to see that and experience that so they could unlock how that could help with other language tasks within their enterprise. And then lastly, that natural human interface was key. Before it was just a black box abstract concept. And ultimately it was heavily focused on prediction probabilities and math showing up in there, which wasn't as easy to grasp. When you could see it actually generating and summarizing information is where you started to see how you could apply this ultimately from front office kind of consumer and patient interaction pieces, middle office things related to care delivery and health management, and back office solutions. You started to, that art of the possible started to become more clear to everyone who was using it. Now, I'll build off that though. That was also happening in the backdrop of a whole set of environmental forces that have been all kind of building over the past 10, 20 years or more. You have pressures related to clinical workforce challenges, as well as non-clinical workforce challenges for health plans and health systems. You have challenges with cost structures increasing beyond what can be sustainable to create sustainable healthcare enterprises. You had changes in regulation, all of these things coming together at once. And all of that was also coming after the COVID pandemic as well, where you saw this massive shift to using digital technology, which really also sparked people's realization that we can change and we can apply digital technology to make improvements in healthcare at scale and quickly.
Yeah, the healthcare worker crisis, the shortage crisis, and the pandemic, as you mentioned, are huge catalysts of just the momentum that we've seen in the AI space and specifically in healthcare. And it's been really interesting to see. And I'm curious just why the previous eras of artificial intelligence, and myself having been in the AI space as an ML engineer since the days of supervised ML, around 2017 is when I first entered the space, were some of the use cases that maybe were promising back in the late 2010s that were essentially valuable and painted the promise of artificial intelligence? And what are some of the use cases today that you would say are very top of mind for you and your team as you enable AI in healthcare? And is there almost a cannibalization of some of the older use cases that traditional supervised ML models were being used for, like you mentioned, the classification, regression, predictive analytics type tasks? Or do you see a role for both of those technologies coexisting moving forward? I'm curious how you're seeing it from a consulting perspective.
There's a role for all the existing technologies to coexist. If you were to look at the set of diagnostic, predictive, and generative, this is really that set and constellation of technologies working together. If anything, I would state generative AI catalyzed the interest, and what it's done is accelerated digital transformation and the idea that we could use automation, traditional good old-fashioned artificial intelligence plus generative all together to ultimately make improvements in how you deliver value and how you create value. So what's actually happening is, in many cases, if a discussion of related to AI at the enterprise level starts, we'll often go back to existing models that could have been used years ago, but really weren't used at scale. Maybe it was at pockets, weren't used at all. And now it's, how do we actually use those that actually have some evidence behind them, have some proof points, have gone through rigorous testing. It really allows the use of high value, high feasibility, as well as lower risk in terms of getting started. Because this really isn't just about the technology. This is about, first of all, what is the human problem we're trying to solve? How do we work differently? Because this really requires cross-functional teams that work across silos, which is very different. That will then change talent needs in terms of how to do that, and then ultimately will impact processes. Once you get started too, you'll also realize that your foundational technology needs improvements. So we refer to that as a digital core, and really moving towards a digital core where cloud is the foundation, data is the driver, and AI is the differentiator. What we find is once you get excitement around AI and generative AI, then you start to look at tech enablement, and you start to see what hasn't been done over the past 10, 20 years. So there are a whole set of healthcare organizations that really haven't started or are very early in their journey to cloud. So the ability to shift to cloud really is a key enabler to get access to algorithms, as well as to have your data put together in a way that can be usable and useful for both good old-fashioned AI as well as modern generative AI. So we get started with excitement, and we often have to go back to building out that digital core in parallel while testing multiple forms of automation, AI, and generative AI as well.
That's fascinating. So generative AI has really been a catalyst for unlocking the value of technologies that you've developed previously as well. And the excitement piece has been the primary driver of all of this now that it's palpable. And there seems to be a tremendous amount of urgency as well to deploy and keep up with the Joneses, so to speak, when it comes to adopting AI and leveraging it to just improve both operational efficiency and care delivery. Do you have any examples of past technologies that maybe didn't get a lot of adoption, but maybe are now getting more adoption because folks are excited about generative AI? You mentioned cloud adoption, folks moving to the cloud. There's been an impetus to get more folks to do that, but are there any other types of ML models or specific pieces of tech that come to mind?
Yeah, maybe I'll go broad in general and get to some specific use cases, as you mentioned. So if I go broad, it starts, like you mentioned, one, getting a strong cloud foundation, whether it's using public cloud, private cloud, or edge, and how do you actually think of that cloud foundational infrastructure, and how do you shift more meaningfully to that? Part two then is the data foundation. How do you actually move data from silos towards some sort of unified data platform across the enterprise? Many organizations still have significant silos of information, also have not blended structured and unstructured information in new ways that can be useful and usable. And then third is, how do you unify that where you can actually have different models and algorithms on top, which the tooling of putting that all in place still has a long way to go. If I go to specific use cases, and this kind of goes back to one of your prior questions, we've already seen AI isn't new, as we were stating. It's been in use for multiple years. It's adding value. If you use some examples, I mentioned early in my career where we were using predictive models within health management programs and population health. Common use, still out there. You're just seeing those models improve and get more refined. You've also seen a heavy use in administrative processes, specifically within health plans, where you've seen use within the claims process for payment integrity, fraud, waste, and abuse, and different situations there. On the provider side, you've seen a lot of uses of traditional machine learning models and deep learning models related to revenue cycle. How can you help with coding accuracy and so forth? Now the new phase is just adding on to that and really thinking holistically about how do you put all those different capabilities together and enhance algorithms that existed. If I were to go with maybe another thing that is different is often those use cases in the past and those algorithms would exist within individual functions and pockets. What's happened is this is elevated now of how are we looking at this across the enterprise. So there is a bit of a needing across the entire healthcare enterprise what is already happening, because it's not many organizations already are doing something. So it's what's already happening, what could we do, and then how do we actually build that foundation to actually do more and do more faster becomes a key thing. And I think to your point, one reason is if I go to the value potential, if you look at how does this help with value is, research we've done really has found that in healthcare, over 40% of tasks of both a health plan and health system really are language tasks that have high potential for automation and augmentation. So that obviously is capturing attention. And there are multiple research reports that are very similar. That's in addition to being able to experiment hands-on and see the potential, seeing how that can be used to change work also is driving a lot of excitement. Now, the challenge is that's potential. To unlock that potential requires a lot of hard work and a lot of patience and dedication. It really requires a reinvention of work, not just applying an algorithm on how things work. You have to really think, how could work or processes be done differently? If you free up time, what do you do with that freed up time? How does that change the skills and the workforce you need? How do you then prepare workers for that new future that is ultimately human plus machine?
That's fascinating. And can you walk me through just what an engagement might look like? Let's say, hypothetically, you have a health system that is just crazy about AI. They haven't necessarily been able to adopt it before. Let's say they're a little bit behind on their cloud adoption. That's something that they've just maybe kicked the can on for the past decade or two. And now all of a sudden they want to just get ramped up as quickly as possible. They want to have that chat GPT interface internally so that they can query on clinical data as quickly as possible. What is an engagement look like within Accenture? What does a timeline range look like as well for getting them from start to just being able to work with some of these tools and be able to ramp up some of their existing workforce to be able to leverage those tools in an effective manner? Can you paint the picture of what this might look like for a health system that is eager to get up to speed, but is maybe way behind?
I'll start first with describing a bit of a background of our services, and I'll go with like how are we seeing both health plans and health system get started. So if I go with, in terms of our services, we really have 10 services to be able to help with reinvention enabled by AI. So that includes plan services, helping with upfront strategy, build services, whether that's building people, process, technology, as well as run and operate services. So plan, build, run, really end to end, be able to do that kind of change. And many clients could come in at any of those points. Some could state, I don't need plan help, I need build help. Or I need plan help, but I'll take build on my own. If I go with what has been happening, a lot of this has started with the plan side first. And when this starts, this elevates up to looking at the enterprise, to go looking at both value capture. So where could we capture value across the end-to-end value chain? 2, organization and governance. How should we structure to drive that change? And how should we think of responsible AI? 3rd, it would look at tech enablement. And that is an assessment of where are we at and where do we need to be in terms of what's already in place. And that ultimately sets the groundwork for all the downstream change to ultimately unlock the value. In many cases, in parallel, there will be initial experiments where there's some no regret moves or use cases that you'll get started with, often in areas that are high value, high feasibility, and low risk. So a lot of back office processes where you can show value today at pace so people can realize that this is real. There have been a lot of attempts to apply technology into healthcare, which has led to negative labor productivity and so forth. So there's a big need to show value. It's a bit of show, not tell. And how do we actually learn by doing while also shaping that overall roadmap for the future? After an initial phase like that, you'll then start to launch a set of use cases and individual functions. And what we've started to see is once people start to see the value, then you start to see that this really does impact end-to-end processes. It does require thinking of talent differently, and you need to improve different aspects of your technology, which then starts to drive a broader kind of reinvention of the entire enterprise.
There's so much to dig into there. And the part that really stuck out to me was the governance piece, because that's always been a very critical part of AI enablement, even in the days of supervised ML. And it looks slightly different in the world of LLMs as well. And I'm just curious, when you're implementing these tools and technologies into organizations, when you're building some of these tools into the organizations and having them run on a continuous basis, what does governance look like for generative AI applications?
So governance and responsible AI, I would state, are a big challenge. I think a big part of this is both in terms of deploying solutions and deploying them responsibly is requiring significant cross-functional collaboration and ways of thinking that are very different than how they have been operating traditionally. Often there is a bit of starting with defining responsible AI principles, starting at the high level. How do those principles then feed into operational processes all the way down? How do you bring legal compliance and regulatory to the table up front? How are those functions engaged in shaping those principles? How are they helping decide what to do, what not to do? I will tell you, it is very early days and it is a big challenge, specifically for organizations that are early on their cloud journey. Because if you haven't gone through and if you don't have legal compliance and privacy frameworks in mind about how to manage data on cloud, how to think through cloud marketplaces of services and data that's going back and forth, it becomes very challenging to think of frontier algorithm-based models if you're still struggling with how do you use a SQL Server database on Azure in the cloud.
And do you typically, during these engagements, you recommend that organizations use a unified platform all throughout the cloud, the data foundation, and the unified stages? Or do you typically pick a best of breed approach just to ensure that you have high levels of governance and just simplicity really for organizations that are rolling out their V0s or V1s of their generative AI tech stacks?
Yeah, the reality is each organization is different and both approaches work. It has to fit with each individual organization's culture and strategy. I think there is a broader move towards that digital core concept is an enterprise platform, but in many cases that is a platform that is plug and play. But you need to have governing decisions about what will plug and play into that ecosystem and how do you think about it. And I think that early stage thinking is starting. Some are farther along than others. Some are just starting, but there's a lot of good progress being made in that space. I know there is a one kind of, once you've figured out what to do, the why and the what to do, if you get into the how to do it, we look at many organizations looking at build, buy, and boost. So that's, are you building your own solution? Are you buying a solution that's either an extension of an existing vendor or a standalone solution, or are you boosting some model that may exist out there in the market? There's a big focus on working with existing vendors out of the gate to get started and getting and leveraging extensions of existing solutions as a place to start, and then testing the waters with boosting models. And a big part of that is cost, talent, and tech. It becomes an easy way to start.
When you're implementing AI into healthcare plans and systems, what is typically the biggest challenge? Is it on the technology side? Is it on the change management side, governance?
Yeah, I'd say the biggest challenge is the human side. I think it's the change management. I think increasingly we'll talk about AI and I go, really, this is about human problems and change adoption. And I'd say this is even really hard because the pace of change is so fast that even if you're bought in, you have to continually adapt and change, which is hard for all of us, I would state, regardless of where we're at. So I'd say some of those biggest changes are, how do you work differently? How do you work in a multidisciplinary way? Many established organizations, both inside and outside healthcare, have more of a project orientation than a product orientation. So there's an operating model shift from project to product. That product also needs to include multidisciplinary teams. So it's AI engineers, product designers working together as one. There were some concepts like the Deep Scribe episode you had before referenced that. That same challenge also is existing within large enterprises that are even further behind, used to doing an IT project versus nurturing a product. So that becomes a big shift. This also changes work processes. So because of that, you're now having people have to change how they've done work. That's a big shift. So how do you get people like humans and machines to work together? How do you educate about how to work alongside technology as a partner and a co-intelligence? That's a major shift that we haven't seen before. I'd say equivalent to, if not greater than, what we saw with personal computing coming into enterprises, as well as the internet. Similar types of change.
What are the things that you've seen work well and maybe not so well when it comes to getting folks up to speed and more familiarized and comfortable with co-working with these AI tools?
Yeah. A big part of this comes down to, there is a learn by doing aspect. I think a big part of this does come with leadership and leadership teams. One, getting familiar with these tools and getting hands-on. A couple key principles Ethan Mollick, the professor at Wharton, states that I think also hold true, that are true for leaders, whether you're at the top of an organization or at the bottom working in operational processes. And I think this holds very true to helping drive this change. One is, invite AI to everything you do, every task that you're able to do. And because of the new tools we have out there, that's more possible than traditional or good old-fashioned artificial intelligence models. Two, be the human in the loop. So it is that co-intelligence, work together with AI and figure out what it is good at and not good at, because we don't have a manual for this. Three, treat AI like a person. It's your best intern, but it is like an intern. How do you actually, some of the expectations can be greater than what the potential is today. Often when we start to introduce very simple things like using Microsoft Copilot or Google Duet as an example, there's an assumption that I'll just type some things in and I get an amazing PowerPoint that solves all things. And you realize that it can create a good outline. The PowerPoint itself might be okay. It's not good at full automation of that task. It's good at helping you with pieces of that task. And figuring that out is a challenge. And to do so is, treat it as if it was an intern and go back and forth and iterate. And then lastly, assume this is the worst AI you will use. I think there is this thing of keep trying. It's that continuous reinvention aspect to this, is what you are using today, these tools get better and better every few days and weeks. If it didn't work today, try it tomorrow and be persistent. To the point of change, it's very easy to go through stages of grief and think that it won't solve your problem. And it may not today, but then if you don't come back to it a couple weeks later, you might miss the mark.
I'm curious to get your perspective on just how familiar are folks with this tooling on the ground? And the reason I ask this is it's so easy for us to get caught up in our bubble where we've been in AI for some time now, and we understand everything that's happening, all the incredible work that's being rolled out, all of these great models are being rolled out on a weekly basis at this point, which are just making last week's model look completely outdated. And the turnarounds for these things are incredible. But I grew up on a farm in rural Maryland, and a lot of the folks that I grew up with, they may have heard of ChatGPT, but I'm oftentimes quite surprised with how little they've maybe adopted the technology and tooling into their day-to-day lives, where they could save a lot of time, candidly, and maybe even improve the quality of their work and even outside of work, but they're just not leaning into it maybe as heavily. And so it's always an eye-opening experience for me to just see how most of America has reacted to this technology versus the way that you and I have reacted to this technology is just being plugged into all of the innovation that's happening. What is it like on the ground when working with these health plans and systems and the admins and executives in these organizations? Are they actually as plugged in as we might expect from a Silicon Valley perspective, or would an average listener be surprised with the level of familiarity?
I think that I would state there is a lot of room to go in terms of familiarity. I think it is the fastest uptake and use of any other technology that we've seen in the last 20 years. However, that still is not the majority in terms of use. And when you go in, a lot of that goes back to that learn by doing and invite AI to everything you do. It also ties to change management. Often a first step as we go in is to both show, not tell. How do we show different tools? How do we get people hands-on? How do we find people who are power users who have adopted and bought in and are using it? And how do we bring others who maybe experimented once or are aware of it but haven't tried it? How do we get them to experiment and stay and provide support? So you are right. It is very early days. I will state the technology is advancing significantly faster than organizations change. Healthcare enterprises and large enterprises are complex adaptive systems. They take a long time to change, and in many cases by design. They're designed in a way to deliver output. So changing that in a way that is safe and responsible will take time. And we've seen that with other technologies as well. I think the key thing is, how do you get started? And how do you go across looking at value first, looking at responsible use, and then also ultimately, how do you rethink work and manage change and keep iterating at it to ultimately drive impact?
On the managing change front, do you imagine that's going to evolve quite quickly as these models get much better, these applications just get much better at just understanding end users more quickly, and maybe shortening the time of molding these applications to fit in with a very specific use case for a specific clinician, for example, that might be using them? Or do you imagine that we're a long ways from that and we're essentially going to have to learn how to work with these technologies for the foreseeable future, and there will be a long tail of personalization and adaptation that really is only going to be solved for through change management?
It's interesting. It's an interesting one where maybe I'll go back to this will take time. And in terms of driving change, I think a big part of that is there's one, just general awareness, but two, this does require reinventing work. And that does require trust and new ways of thinking of human plus machine. So it really typically will start at a smaller scale and getting proof where you're designing solutions with people in mind. I think maybe if I go back with all this comes back to that fundamental principle of lead with value, what is the human problem, and are you involving people who are end users in the design of the solution to make sure that it's useful and not just technology for technology's sake. That typically, and because of this, it does require you to change processes. So there is a very hands-on intensive set of activities of working hands-on with people in operations and on the front lines to figure out how should we change this? How should it work to make sure that it's solving problems on the ground? That what we typically find is when you ask users what their problems are, when you involve them in shaping solutions to those problems and you're co-creating that, you start to get buy-in out of the gate because you're designing it together versus just trying to plug something in.
Yeah, and I think a lot of where that question comes from is the Silicon Valley mindset of how much can we automate and how much of this can we just provide value out of the box. But like you said, I think there's just a tremendous amount of all of this when it comes to AI enablement in health enterprises that really isn't dependent on how good these models get. It's more so, how do we make folks more familiar with it? How do we identify the right value levers? How do we understand where exactly to plug this technology in? And so the need for this human AI symbiosis is going to be here for quite some time. And it's not something that we're going to be able to automate and is not necessarily going to be impacted or replaced. The need for it isn't going to be replaced with just better models.
Yeah, we list this as 5 key imperatives for healthcare organizations. And we've mentioned this throughout the discussion. 1 is lead with value, and that starts with what is the human problem you're trying to solve and making sure that it's solving an organizational challenge. 2, enable a strong digital core, where cloud is the foundation, cloud is the enabler, data is the driver, and AI is the differentiator. 3, reinvent talent and ways of working. So that includes reinventing work, reshaping the workforce, and preparing workers for that shift. 4 is close the gap on responsible AI. So that is, how do you actually shape at the organizational level? What are those principles? And then tie that into how you operate, all the way down to building models, changing processes. That's really hard to create that connection. And then the last one is drive continuous reinvention. And that ties to what we're saying. A key thing is you don't have to wait until you have a perfect digital core foundation in place. You don't have to wait in terms of getting it all figured out. The key thing is to get your hands on now, get started, and start iterating to build out those components so you can learn with hands-on application. And I think that's where you're going to start to see new ways to create or deliver value and new ways to create value for people start to be unlocked.
Now, shifting gears very slightly to some of the initiatives that Accenture has worked on that you might be able to highlight. Are there any key AI-powered healthcare projects that Accenture is currently working on or has worked on that you would be able to share details on, or maybe on the strategic partnership side, anything that you're excited to share?
Yeah, I'll share a couple examples. If one is work we've been working on with a health system, and the key challenge there was really around the clinical workforce. And I think the challenge there was, how might we create really a new clinical care model for the hospital of the future and for the worker of the future? And a big part of that is realizing there is more demand than there is supply of clinical workers. So how do we create care models that ultimately are human plus machine by design to ultimately help provide care to meet that demand in a way that is follows the quintuple aim in terms of delivering on that value? So in that particular instance, it wasn't even, I would say, AI was an enabler. It was in the background. So this was really around, okay, what are the challenges that doctors and nurses are facing on the front lines, specifically in the hospital setting? How can we understand, now, given what those challenges are, what of those tasks could we automate or augment using technology? And again, this was with the physicians and nurses to thinking through what could be good tasks for that. We've then mapped that into different solution sets that could solve those different aspects. Those different solutions and concepts were bundled then into new care models. Ultimately, that was around task shifting. How do we shift certain tasks to different types of workforce areas? How do we shift some tasks to technology, ultimately to be more human plus machine? And ultimately that created a set of care models, some that were, let's say, augmenting and enhancing existing models with some technology, and some that were on a farther extreme that were true human plus machine models. And some of that was grounded on research we have done looking at what could be automated and augmented. And if we looked at, for an example, 10 registered nurses today, when you look at the tasks that a registered nurse can do, really you looked at in the future, you'd be able to have 4 nurses, registered nurses working as they do today, 2 adaptive workers, as an example, basically flex workforce that would change, and then the balance being put towards technology, all working together as a different system in terms of tasks. Now the question is, how do you roll those models out in a way that is safe and effective? So where we're at now with that is actually starting to deploy pieces and parts of those models in a way to ensure that it's safe and effective, and testing that they'll work effectively. Now, if I contrast that, there are some health plans we're working with where we went through that process of shaping that broader enterprise AI strategy, looking at value capture, org alignment, and responsible AI and tech enablement. From that high level, we started looking at areas like customer service, as well as procurement and legal. And a lot of this is looking at back office processes and paper. How do we, and to the prior question of, is this generative AI or good old-fashioned AI? Many cases we're finding good old-fashioned AI is doing the job. So we have a lot of situations where inbound correspondence, paper coming into a health plan, where we're able to classify, is this appeal or not an appeal? If it's an appeal, then going down these decision queues. What we've started to see with some of those is that has driven significant improvements in reducing backlogs. In many cases, large backlogs of paper waiting to be processed with lots of wait time. So we've started to see those types of enhancements come in. That ultimately is unlocked. Once you did that, now they're seeing the value, and it's now catalyzing a broader change across the entire organization, across all functions.
And it sounds like once you unlock that first value lever, once you're able to show value for one of these use cases, what is the level of excitement or just willingness to just put the pedal to the metal in these organizations?
I would say each organization is different. With that, I would state, again, everything kind of falls in a third. There's about a third that I would state that catalyzes broad change. There's about a third that go from maybe a couple use cases and say, let's look broadly at a function and let's see if we can change a function. And then there's a third that I can struggle to get beyond a proof of concept or a use case. And a lot of those struggles are coming because of leadership challenges, structural and governance challenges, incentives challenges that are out there. That does come down to, do you believe this to truly change the business? Is it interesting or important? As an example, there is a group that find it interesting but not important. So they can check the box and say they've used AI, but they haven't necessarily changed the organization.
Yeah, that's fascinating, because it feels, especially in the healthcare space, the ROI for generative AI it seems pretty apparent and obvious across different health plans and systems. Where would this reluctance come from? Is it more so just late adopters, we'll see how this shakes out, then we'll essentially revisit this in a couple of years? Or is it more so just maybe a failure of identifying exactly like what the ROI might be in a more tangible way? Or is this something else? Is there a case that there is a category of enterprises in the healthcare space that just may not benefit much from generative AI at all? And just, I understand I'm biased, and especially maybe don't understand the third POV as well, but I'm curious to get your take on that.
I think part of that goes back to some of the points we discussed earlier. One is we are early in this evolution. So there's a group that now understand that this is important and impactful, but understanding how big the change could be and potential and how much value it could create may not be fully understood yet because it's early in terms of experimentation. The second part on that is there a burning platform? Is there specific, do you need to change? Given if your overall business is stable and sustainable, there isn't necessarily a massive imperative to shift. And then the third part I would state is on value. There is a lot that is not proven. So there is value potential, but not proven value. So if you have more risk aversion and you're trying to ensure that you're keeping things stable, there is higher risk by experimenting with some of these things. So it does follow that fast follower piece you were describing of I'll wait to see what others have done, and then I'll start to apply once I have more proof points of where value can be created.
Yeah, and I think the perception is probably that this is a beta testing period for a lot of these technologies in the healthcare enterprise. And so framing and perspective does help maybe explain the different behaviors across different folks. And some folks are excited to be a part of the beta testing cohort, and some folks just want to wait until you're out of beta.
And that's where it roughly maps with that a third kind of concept. And I'd say what's different is we got to that at a faster pace than we've seen before. There's that third that see that potential and are willing to be the beta testers. There are those in the middle that are at least hedging, balancing risk, that are starting to move, but just at a slower pace. And then there's a third that maybe are experimenting, but not moving more broadly out of the lab.
I see. Also, I want to be mindful of time, Brian. Really fascinating discussion. I'm curious if there's anything in particular that you want to make sure that we cover that we haven't already.
Yeah, I mean, I'll just summarize a couple key points. One, I think what's different here is where are we at and what moment are we at. AI, specifically generative AI, was a general purpose technology that will change economies and industries, boosting productivity across all sectors, including healthcare. A big part of that is because AI enables organizations with new ways to create and deliver value. When research, ultimately though, to do that, AI will transform work across every industry and every job category. When we look at healthcare specifically, research we've done sees the potential to automate or augment over 40% of healthcare jobs, both clinical and non-clinical, through automation and augmentation. However, to unlock that value and that potential really requires organizations to reinvent work, reshape the workforce, and prepare workers. And that is hard and will require dedication and persistence towards seeing value. To do that, though, a strong digital core is required organizational infrastructure to unlock that potential. And that includes cloud as the enabler, data as a driver, and AI as a differentiator to ultimately create that competitive advantage. Underlying all that, though, is then responsible AI and use. How do you ensure that you are fostering trust with all the stakeholders you serve by putting that responsible foundation in place? And I'd state the key thing for leaders to unlock all those pieces is really to start using AI in everything they do, and encouraging workers to use it and exploring how to use AI to reinvent their organization. So both top down and bottoms up, all together to create that future.
So I have a fun question for you. What role is Accenture playing in training and upskilling the workforce at Accenture to use AI effectively? Just so you're dog fooding the tools and technologies internally.
No, that's a great question. And I'm going to actually go back. So this is even prior to generative AI. Quite a few years back, we started to roll out where every employee across industry function, whether you're in strategy, consulting, technology, or operations, one has a foundational learning curriculum that we call technology quotient, or building up your TQ. And it's really having everyone build their digital fluency and understanding, you don't have to be technologists. It's understanding how does modern digital technology change business and society. So that included topics like cloud, data, artificial intelligence, quantum computing, spatial computing, multiple topics. And that's an ongoing program that we've been rolling out to drive education. But it isn't just about, like we said, learning and the education piece. We also have been very hands-on. We have one of the largest deployments of Microsoft Copilot across our workforce. The minute Copilot became available, we've started rolling that out across our workforce and doing so in a responsible, staged way, where a majority of our workers have access to Copilot to test how can this be used for personal productivity. We've also been rolling out specific built generative AI tools to help us do work better, whether that's improving how we do software development, whether that's improving how we do operating model design, merger integration work, growth strategies. We have aids and co-intelligence that help us do those tasks as we roll this out. It really comes down to that. We have to lead from the front and learn by doing ourselves and not just talk about it with clients. So we're able to bring those examples into how that can drive change.
Brian, thank you so much for the time.
Yeah, no, Haroon, appreciate the conversation and for inviting me in the podcast.
Thanks, Brian. My pleasure.
Good day.
Take care.